Hi, I'd like to share with you some information about California's child's eye care crisis. Tens of thousands of children don't have the tools they need to respond to the COVID-caused online school. Thousands more will wait over 2 months to receive their prescribed glasses. Just another unseen casualty of the year 2020. The loss of academic opportunity for thousands of online learners might be the biggest lingering legacy that in the challenges faced in 2020. January 1st, 2020, the Department of Healthcare Services in a memo said that all coastal counties will only be allowed to use the Cal PIA optical lab for the fabrications of all their optical lenses. This unifies the monopoly of a single provider to provide all the eyeglasses for the entire state of California under the nonprofit Prison Industrial Authority. My name is Doug Major. I've had the pleasure of being a child's advocate and serving children in our area for over 35 years. Our program, called Slow Lion's Eyes, screens professionally 55 schools a year, along with a sister program that checks the vision care for all the preschoolers in Head Start and beyond. So when this memo came out, we found an immediate change in how we do business. Now, instead of being able to get a child her glasses a day or at most a week, now children are waiting over 2 months plus, as well as all of the difficulty in dealing with the state bureaucracy and the separate system the PIA has from our regular flow of ordering eyewear. But this didn't just affect me. The effects immediately changed the way eye care was provided in San Mateo County, reducing the possibility of or location of places to receive glasses to just 3, and reducing the number of willing providers to not only provide glasses but to give the exams. In Santa Barbara and San Luis Obispo County, Sentinel Health, our leadership violently fought this expansion because they knew what would happen to their Pervanel panel. After self-funding those fabrication of glasses themselves for 6 months, they had to bow also this policy. And again, as expected, an almost immediate collapse of willing providers, particularly in the Santa Barbara area and those serving the tribal communities. Of course, the CIA CalPERS Lab are really not they're not consumer-centered. Comments like, "Don't call us if the order is under 8 weeks in our lab." They shouldn't complain. They're getting their glasses for free. "Don't send patients' own expensive frames. They might be stolen," are common comments not only made to our office, but to others. As the managed care leader of SynCal Health eloquently stated, "The handling of this vision care crisis perpetuates the perception that Medi-Cal is poor access to poor service for poor people." So who's in charge of this? Well, it's the Department of Healthcare Services, who in the current year will receive $126.3 billion for the support of the healthcare of our state and our children. Last year, the budget was $118 billion. And of that, the Department of Healthcare Services invests just 0.000144% of their budget to our children's vision needs and optical needs. That's 14 cents on every $1,000, a very small part of their budget. So who does benefit from this program? Well, Cal PIA billed the Department of Healthcare Services over $17.5 million, and they made $6.5 million profit. This profit was money transferred from local small businesses to the correctional industries. And no question, the PIA helps The inmates find work. 217 were able to be involved last year out of 180, meaning that they had a shortage of over 63 optical workers. With the prison population decreasing, there's not enough inmates to do the work. Well, this must be saving the Department of Healthcare Services a lot of money, right? For them to go through this issue. Well, maybe, but maybe not. It's difficult to get the actual numbers. But really, to think that the PIA optical could succeed in this very, very competitive eyewear market was folly without being its a forced sole provider. And this is just not a coastal issue. This lack of vision care is now statewide. Austin Buhner, now the superintendent of the LA Unified School District, said this: if deeply rooted poverty and an underperforming public education system strike you as irretractable problems, think again. A simple yet powerful tool to kids in need. The tool? A pair of glasses. Of course, we don't have to say the positive effect that glasses can have. The UCLA study showed improvement not only in math scores and reading, but actually quality of life measures were overwhelmingly positive. And this is just the tip of the iceberg of overwhelming research that shows the benefit of early correction. As nonprofits need to take this on, the Vision of Learning launched its project in San Diego, and this was in their newspaper. 51 children at the Oak Park Elementary were delighted today when the San Diego Padres helped them try on their brand new glasses. The glasses were provided through this nonprofit Vision to Learn and will provide thousands more. An estimated 54,000 children in San Diego County, let's say alone, that goes to school every year without their glasses to see the board, read the book, or participate in school. Since these are all Title I schools, that means that they all have Medi-Cal coverage to provide a vision exam. And so it's exciting that 51 pairs of glasses were handed out, but 51 out of 54,000. Do you think this might be a policy failure? And people don't realize this, but Medi-Cal provides coverage for nearly half of all children in California now. So the Department of Healthcare Services is responsible for the vision care of over 4 million children. And if you think that 50,000 enter the schools without glasses just in San Diego County alone, why do we need nonprofits to provide the care that the Department of Healthcare Services is so well funded for and is morally responsible for? And this coverage isn't free. When a working family of 4 makes just under $70,000 a year and applies for healthcare insurance, at the Covered California program, their children are assigned to Medi-Cal. They pay for that coverage, and they're promised eye care for their children. It's interesting as this year has progressed how the Department of Healthcare Services responds to this crisis. Instead of allowing the remainder local providers to use their existing sources and immediately provide the care for these children, the Cal PIA has contracted out to 7 other backup labs. You can sort of imagine what they have to pay for that. And so this is obviously not an issue of money or good care. It's an issue of control. So we ask for a call of action. Governor Newsom, honor your promise to increase the access of care for children. Department of Healthcare leadership, reevaluate this 40-year marriage with the Cal PIA. Update your vision delivery system to maintain your existing panel of doctors who've stuck it out and reinterest the hundreds of providers who have left and encourage them to serve the children of our great state. Cal PIA leadership, stop your direct competition with small local business providers of vision care. Reevaluate your mandate as prescribed by law in the Penal Code 2808I. And constrict your optical footprint as the prison population constricts. When you see something that is not right, not just, not fair, you have the moral obligation to say something, to do something, John Lewis. You can judge a society by the way it treats its children. One of the greatest expressions of love that a society can give its children is to educate those children with the resources they need. Kamala Harris. Let's do the right thing for our children. Make it not only accessible, but easy to obtain the tools and resources to succeed in school. Providing access to vision care truly should be the easiest, the most cost-effective, high-leverage way to help the children's chances to reach their full potential. As the UCLA Roski Eye Institute research states, this research is a bellwether that visual impairment in young children can be prevented or treated with low-cost solutions if we intervene at an early age. If we don't, the long-term effects of impaired vision at an early age that can adversely impact academics and social achievements will put our future generations to a distinct disadvantage. This is a population transformation imperative. I hope that we follow up on this health imperative. Thank you.